Now, in a bid to support Singapore's transforming healthcare needs, the Health Ministry announced a whole slew of initiatives in Parliament yesterday. And for more, we're joined by Senior Minister of State for Health, Dr. Amy Khor. SMS, thanks very much for coming in. So we heard about the Health Ministry working with MND to basically develop this assisted living model in public housing. Tell us more about that. How will this meet the demands of our healthcare needs, which are evolving at a pretty incredible pace?
Well, first of all, let me say that actually there are already a range of housing options for our seniors to meet their different needs and preferences. One example would be Kampong Admiralty, where senior housing is actually integrated with a wide range of health, social, communal, community, commercial and retail facilities. But what these housing options don't have really is that they are not sold or tied together with a care service package. So MOH has worked closely with MND and HDB to develop this assisted living model in public housing, which is twin with a care service package. And I think from our focus group discussion, this typology has received a positive response, especially from seniors who are singles and living alone. The key features of this assisted living flats really are firstly that they have enhanced senior-friendly features. So larger bathrooms that allow for sponging and bathing, when the seniors get more frail and they need higher care needs. There is an elder care center that is co-located with these flats so that they can get healthcare and social support services. And then on every floor, there is a communal living space, so it allows the elderly to use it to socialize, to build up mutual care and support. And the basic care service package that will be twinned with this housing option will be 24/7 emergency response system, as well as an on-site community manager that will help to monitor the health status of the elderly, link them up with the care services that they need, and also facilitate activities to get the residents together. So this assisted living flats will be in Bukit Batok, the first pilot, 160 units, and they'll be reserved for seniors aged 65 and above, and there'll be some flats that will be reserved, priority given to seniors with care needs.
Right. SMS, so we must not forget the caregivers. They're just as important as well. And we know that many of them face really immense stress, having to juggle not only work, but also caring for their loved ones. How do you think they can then be better supported?
Well, so last year we actually launched the Caregiver Support Action Plan. And really that is to enhance the support to caregivers of seniors in their caregiving journey. So some of the initiatives that we have enhanced relate to care navigation, how to find the resources for caregiving, support for caregiving, and then caregiver training. So we have this Elder Carer Foreign Domestic Worker Scheme where the FDWs will be trained before they are placed, and the caregiver can access an annual $200 subsidy under the Caregiver Training Grant to offset part of these cost fees. We have also enhanced our respite care options for caregivers of the seniors, right? And currently there are 20 elder care centres and 40 nursing homes that are offering these respite care options. In fact, some 3,700 seniors have actually benefited from this. And last year we did 2 pilots, new respite care options. One is for caregiver of cancer patients on home palliative care. Another one is a night respite option for caregivers of dementia patients with behavioural and sleep issues at night. And then, of course, I just announced that we are going to have a caregiver or a structured support system for caregivers, where the hospitals and community partners will work to have a structured support system for these caregivers of persons with mental conditions, because these caregivers are at higher risk of burnt out. And what that means is that on first diagnosis, the caregivers will be provided information about disease progression, about expected care needs, and also link up with the necessary support services. So our idea really is to assure caregivers that they are not alone in this journey and that they have a strong support system for them.
I want to move on to the topic of sugary drinks, because there were announcements on that as well. I think the nutrition labels are now going to be extended to freshly packed drinks. Previously, we already knew that they were going to be pre-packaged
beverages.
How far is this new extension going to go towards fighting diabetes, fighting sugar in Singapore?
Well, This nutrient summary label, which is color-coded, and we call it the Nutri-Grade, really is to give information to the consumers so that they can make healthier choices, and also to influence the manufacturers to reformulate the beverages. And I think that countries that have actually implemented a similar labeling system are beginning to see benefits from consumer as well as industry, a shift in the consumer and industry behavior. So for instance, according to a 2018 study of the chili warning label, so chili has seen 20 to 30% reduction in the average sugar content of the beverages, as well as a 50% reduction in the number of beverages with the high in sugar label within 8 months post-implementation. And then in New Zealand, according to a 2017 study of the New Zealand Health Star Rating, right, and that is actually a nutrient summary label, 83% of the labeled products were reformulated within 2 years post-implementation. And in fact, more of the labeled products were reformulated rather than unlabeled products. And actually, we also have an advertising prohibition on the grade D labels,
Those are
beverages, right?
Sugary, yeah.
So the idea really is also to reduce the influence on consumers' preferences, as well as, again, to encourage the manufacturers to reformulate the beverages.
Right. And speaking of consumers, SMS, you are a huge champion of recycling and upcycling. We saw in Parliament you wore a cassette fabric blouse, and today you have something else that you brought in to show us. Why don't you tell us about it?
Yes. So this necklace I have here is actually made from old T-shirts. So it's upcycled from old T-shirts, and I have a few more here. Well, the person who made it for me, she said 25 minutes to make a piece. So not difficult and actually quite pretty, you know. And it's upcycling. So last year we launched our Zero Waste Master Plan, and the key goal really is to reduce the amount of waste that goes to Semakau by 30% by 2030. And one of the things that we are trying to do is to promote 3 Rs, to get all Singaporeans to practice 3 Rs: reduce, reuse, recycle. You know, adopt the circular economy approach, right? Close the resource loop. And for clothes, you can't recycle, so actually you reuse. You try and extend its useful life for as long as possible, either by swapping, so we have Swapaholic, for instance, right? Or upcycling like this, so you can extend its useful life. And I think everybody can do their, a part in terms of 3 Rs. So let's practice the 3 Rs and let's game change climate change.
Yes, indeed. And I'm wearing a jacket that I bought when I was in university, which is more than 20 years ago. Yes.
Is this your way of saying that you can still fit?
Yes, I can. Thank you so much, SMS, for speaking to us. We've been speaking to Dr. Amy Khor, Senior Minister of State for Health and Environment and Water Resources.